kind of the sum of all human experiences. We all have we all have the same emotions, the same core of emotions. It's just, I think combat amplifies all those to the extreme. It's everything just all there kind of distilled into one moment.
Today on the show, more of our conversation with David Kinzler. We talked to him a few weeks ago about his military career and a whole lot more. You can find that episode in the show notes of this episode. Today on the show, we'll talk about his work as a CEO of One-to-One Health and a fascinating story of when he brought his interpreter from Afghanistan here to the United States.
It's one of those things you think is never really going to happen, especially at that point, because there weren't a lot of them then.
Yeah.
And he sends me this Facebook message, and it's like, hey, man, got it. I'll be there Monday. And you're like, oh.
My name is Josh Rowe, and this is Tomorrowtown, Tennessee. Normally we go chronologically through someone's, story a little bit, but if we wait to the end to get to what you're doing now, people might lose some of that. So tell me a little bit about what you do today. You're the CEO of One-to-One Health, is that correct?
That's correct.
So tell me what One-to-One Health does.
Yeah, we do primary care, and we do it in two forms, through physical clinics and then virtual primary care. The difference between us and most primary care providers that you would think of normally is that we don't bill insurance. And so we're not billing patients, trying to go to their insurance company, code it a certain way, and get a specific reimbursement rate for whatever that specific bill is. We do a direct contract with an employer and then provide primary care to all their employees, either in person, virtually, or both. And so what that does is it allows us to align the incentives with the employer, the providers, and the patients. So our providers, they earn a salary. They're not incentivized based on how many visits they do or what type of visits they do. They just get to come to work every day and take care of people. And then from the employer's perspective, ultimately in the commercial space, employers are the payers for healthcare. And it gives them, one, a benefit to offer to their employees, but two, a cost control measure, because primary care is the only component of our broader, confusing, ill-incentivized healthcare system where if you do more primary care, you get better outcomes and you save money.
So in this world that we're in where healthcare, health insurance, all these things are so complicated, what is that space that you guys are in all of that? Because there's things you're telling me that sound like, oh, I see how that works.
Yeah.
But then there's part of it too that adds almost a layer of learning how to do it in a different way as well.
Yeah,
absolutely. Can you explain kind of that space you take up in the healthcare world?
Yeah. So if you're going to put a label on it, I would call it direct primary care. And direct is probably a good idea or a good name, because you're taking out all of those barriers between a patient and their provider. And ultimately that's what we're trying to do is just get a patient in front of a provider and let them have a relationship and let that provider take care of that patient in the best manner that's for them. And so what I mean by those barriers are, how am I paying you? When can I get in? What medium do I have to speak to you in? So does a doctor get reimbursed more for a video visit versus a phone call? Do they get reimbursed if they call you afterwards to say, hey, did you pick up that prescription? Take all that stuff out and just let somebody go see a primary care provider, talk to a primary care provider when they need to. And by directly contracting with an employer, we can do that in a financial model where our incentives are aligned, and ideally you take all the cost burden off of the actual patient.
Yeah. So looking at, I don't know you at all other than the 5 minutes before we started recording here, but looking at your resume on paper, right? It's interesting to see the moves you've made. Mm-hmm. Did you have healthcare industry experience before you made this leap into this?
Absolutely none.
That's
absolutely
interesting.
None. Yeah, it was kind of right place, right time, and kind of jumped at the opportunity. And then the founder of One-to-One is a long-term primary care physician that still comes to work every day, still is a practicing primary care physician, so still sees patients every day too. But I do think that So Dr. Keith Helton is the founder and now board member. I think that partnership of somebody that has been in Keith that has been operating with frustration in primary care for decades, and then the ability to bring somebody in from the outside and designed for not based on the constraints of a convoluted system, but based on what it should be.
Gotcha. Before we move off this topic, is there, if people are listening to this in Chattanooga and are interested in finding out more, what's your suggestion as far as how to do that? Because obviously it's what you're doing seems to be innovative, and so I'm sure people listening go, oh, I want to know more about that. Where can people learn about that?
Yeah, so our website is just one-to-one-health.com. And the other thing, people are free. So our virtual primary care product, it's called Text Care, and it's named that because you can literally just text us. And so in all of our pitch decks, all of our cards, I put my cell phone number out there. I'll do it here too. It's 202-394-3161. Text me, call me. It's kind of core to what we want to be, is accessible, no barriers. Just ask us.
So with that, and one more question on one-to-one and just kind of what you do with the virtual care, and I think we've all had some sort of telemedicine at this point. But there's always a time where you're kind of like, okay, I probably need to see somebody at this point. So explain that kind of that world, if you could, the benefits of that, but then also having other needs at times as well.
Yeah. I think I think of it in that moment when you're scared something's going on either with you or a family member and you don't know where to go or what to do. What do you do? Well, the first thing is you Google, right? And you ask Dr. Google, tells you you have cancer. And then, if you're lucky and you have a relationship with the primary care office, you're calling them and ideally you're getting in the same day, but that doesn't happen for the vast majority of us. So then you're either a couple days out, a week out. If you don't have a primary care physician, you're a few weeks out from finding somebody. And so in reality, you're going to an urgent care or you're going to the emergency room, both of which are bad experiences. And so with us, we want to replace that Google step and then come into the next one and help guide you through a very complex process. And so we just ask us, when you hit that moment, just whether it's 7 a.m, 3 p.m, or midnight, just text us. We'll answer you in under 5 minutes. If we can treat you, we will. And so for kind of your minor acute stuff, chronic disease management, maybe titrating medications up and down that we've prescribed, you're having side effects too, absolutely, we'll do that all day. But actually, it's been interesting launching it because we ultimately increase the use of in-person care. And our top referral is to primary care. We're helping people decide when and where to go, because you have that spot of a trusted relationship to ask, what do I need to do? And we can kind of help guide you through that.
Your path is interesting. So like you mentioned, you went I don't know how directly from Marine Corps to working on Capitol Hill for Bob Corker. But tell me about that experience and kind of what that kind of taught you. I mean, you're talking about Naval Academy, Marine Corps, combat inside that experience, and now you're dealing with, the United States Senate. Some of those powerful lawmakers we have in this country. So what was that like?
Yeah, it was kind of the similar lessons, oddly, when I think about it. So the Marine Corps sent me directly to the Senate. So I was originally, after deploying for a while, they'll send you to called a B-billet, but a desk job or a non-deployable role. And so I was part of the Marine liaison at the Senate. It's a small office in the Senate. At the time, there was 3 Marine officers. And in that role, you are really the lobbyist. So you don't call yourself a lobbyist. You're not technically a lobbyist, but that's kind of what you are between the service and the Senate. And then you travel with senators when they go overseas in their official capacity. So you're the trip operations person. You plan the flights, you book the hotels, you work with the State Department to set the meetings, and you're the operations logistics person to make sure it all goes. So you actually get to go on these trips. So that's how I originally met Corker. When he was chairman of the Foreign Relations Committee, he was traveling quite a bit in that role. And so I would get to go with him and kind of be the operations person for the trip. And then I was leaving the Marine Corps. I dropped my papers. I was going to graduate school. And the person that ran Middle East policy on the Foreign Relations Committee had said he was leaving, and this was January of 15. And they said, hey, would you come up before you go to graduate school this summer and fill that role? And so great opportunity for me, right place, right time. Marine Corps was a great opportunity. Marine Corps didn't care. I was already getting out. I dropped my papers. And so they let me kind of just walk upstairs. And suddenly I was the professional staff member on the Foreign Relations Committee responsible for Middle East policy. And so that first week on the job, I started on Monday. General Allen, who is a Marine four-star general, at the time he was in command of the fight against ISIS, was coming to testify on the progress of the fight against ISIS. And I think this might have been his first congressional testimony in that role. In 2015, this was kind of on the front end of ISIS. And so this was a big deal. And I show up, and there's a lot of lead up work that goes into one of these committee hearings. The big one being an internal memo that goes out to all the senators on both sides, the Republican and Democratic sides. There's one memo. At least this is how Corker's committee did. There were not partisan memos. And so as that staffer, it's my responsibility to get this memo out. So I show up on Monday, like, okay, like hearings this week. I'm sure this is done. Can somebody point me in the right direction? And they're like, I don't know. I don't think so. The Senate there's not a lot of staffers there. It's there's kind of, when there's a Middle East lead, there's a lead and maybe they have an assistant. There's not like this big team like in the executive branch. And so it's like anything else. You jump in, you figure it out. And in the same way that Chantash went back to sleep, Corker kind of was like, hey, you've got it. And of course he had it too. He knew the topics better than I did.
Right.
But he gave me that freedom to run with it and see if I could swim. And so originally it was a temporary job, one that I was not qualified to do. But you kind of jump in and start doing the job. And then like anything else, if it works, you stay. So I ended up staying up there for probably 3.5 years and running Middle East policy, and then become the legislative director of the committee in his personal office. So oversight of all policy, which was, it was just a great experience.
Yeah, I'm sure it was. I want to leave you with this story, and I believe this is. I believe I saw this about you. At some point, I don't know if it was between your time in the Senate and where you are now. There was a situation where you brought an interpreter that you worked with in Afghanistan to America, and we've heard several stories of these things happening. Because obviously, once they work with the Americans, things get complicated. Yeah. And so, can you explain kind of how that happened and why you wanted to do it? And we understand that you brought them into your home and they lived with you for a while, right?
Yeah. So Wahid is his name. He lives in Red Bank now.
Oh, that's great. Yeah.
But so Wahid, in that Marja deployment, Wahid was my interpreter. So I was that was spring to summer of 2010. And so at the time, and still today, there's a federal program called the Special Immigrant Visa, SIV visa holders. And that's for primarily interpreters who serve, at that time it was 2 years. I think they since dropped it to 1 year with Americans in combat. You then are eligible to apply for a visa to come to the United States. And we started, that program started in Iraq. And it was done for the obvious reasons of, hey, if you were helping U.S. forces and then suddenly you go back to your home in Iraq, Afghanistan, there's a ton of risk on you.
Sure.
And so when I left Afghanistan in that spring of 2020, I was the first Marine that Wahid had ever seen. I picked him up. So he'd only done a couple months at that time. And at that time, the law had just been extended for Afghanistan. Originally, it was Iraq. And so there were no Afghan interpreters that had come to the United States. Nobody had met the qualifications yet. And so when I left Marja, I said, hey man, if you ever, there's this thing, if you ever get it, give me a call. And then, went home. And and Wahid actually, we don't talk about it enough, but the interpreters, Marines go for 7 months typically, and then come home for a while, and then typically a year, and then go back. Army was going for 15 months, then coming home, but going back. But you get that break. The interpreters don't. They just go battalion to battalion to battalion. He served with 6 infantry battalions at the height of combat in Afghanistan, all the way up. Started in Marja with us, went up through Kajaki to Sangin, which was probably more violent than Marja. And So he did more than 2 years. I'm not sure. He has probably 2.5, 3 years. And so fast forward to 2014, and it was a Friday in early July, and I got a Facebook message from Wahid basically saying like, "Hey man, like and I knew he was in the process. I'd sent him a letter and stuff like that. But it's one of those things you think is never really going to happen, especially at that point because there weren't a lot of them then." Yeah. And he sends me this Facebook message, and it's like, "Hey man, got it. I'll be there Monday." And you're like, "Oh, okay." And by this point, I'm married. We have 2 kids. At that time, we were living in suburban Northern Virginia. And so again, I go tell my wife, I'm like, "Hey, you know that thing that I told you might happen? Like, he's coming on Monday." And so originally the plan was for Wahid to stay with us for 3 months. Hey, come get your feet under you. And then like get a job and then get out on your own. He ended up living with us for 7 years. So it was a little bit of a failure to launch there.
7 years.
He showed up. And you know the guy, right? Like you served a combat with him, but do you really know the guy? Like maybe not.
Right. Yeah. It's a different environment for sure.
Totally. Yeah. Right. And so I picked him up at Dulles that Monday. And I actually had to go on one of those trips with Corker on Wednesday. So I was really nervous about this because I'm going to leave the country. And so I had coordinated with another Marine buddy of mine, like, okay, on Wednesday, we're going to go stay at his house. Wahid had been both of our interpreters. And so at the time, they did not use their Afghan names. And so Wahid, to me at that time, was Kobe. So I was talking to my best friend, Nick, who had served in similar areas. And I was like, "Yeah, Kobe." And he looks at his picture. He goes, "Man, that's super bad." So he'd actually been Nick's interpreter too, which we didn't know because he'd used different names.
That's hilarious.
So I said, "All right, you're going to go stay with Nick on Wednesday, get this whole thing done." But so I picked Wahid up at the airport. I was coordinating that trip for Corker, so I was actually late to the airport. And I thought, Afghan guy coming to the U.S., that this is going to take forever to get through immigration, and of course not. They, comes right through. And so he's just sitting on one of the Jersey barriers, right? And he's honestly, I was probably 2 hours late. It was not not my finest moment. And he's sitting there in the street just watching, an American airport,
right,
and loving it. And I walk over to him, and he's got one tiny carry-on. I'm like, you got clothes? And he just looks at me and goes, "Did you want me to bring my Afghan clothes?" Right. I'm like, yeah, that's probably a good point.
Right.
And so we get home, comes in, meets Ashley, my 2 sons, and opens up the carry-on, and it's filled with gifts for my family.
Oh, wow.
And so he's a wonderful person. And so ended up staying with us for 7 years, ultimately made the move to Chattanooga with us. And then his family, when the Taliban took over Afghanistan, I guess 3 years ago now, we ended up, which is another wild story, but we ended up through complete luck being able to help his family get out. And so his mother, father, brother, and sister also live in Red Bank. And he's got one sister in Turkey who is there on a student visa and kind of stranded. She can't go back to Afghanistan. She's educated. She's getting her master's degree now, but if she goes back to Afghanistan, all of that's done, right? Women can't even go to school there. And not to mention the personal risk to her from her brother, but probably more importantly for her is just the complete, I'm this smart, she's the smartest of all of them. Samaya is her name. What do I do? She can't come here. And so she's kind of just continuing her schooling, trying to find a spot to land because ultimately she'll get kicked out of Turkey by the time her school ends. And then he's got one sister who is married that's still in Afghanistan.
A big thank you to David Kinzler and a big thank you to you for listening to Morrowtown, Tennessee. This podcast is a production of News Channel 9, Fox Chattanooga, and Sinclair Broadcast Group Chattanooga. I hope you join me again real soon.